Live Active was born in 2014. I met a 35-year-old. She had a headache one day and went to an urgent care and was diagnosed with high blood pressure. She didn't take the medications because she thought she was stressed because she's a single mom and working multiple jobs. But she ended up having a massive stroke. After she was unraveling the story and sharing it with me, I started to realize there was no one there to educate her, advise her about the importance of blood pressure. There was no relationship that was established. And it was at that moment I realized direct care has to be applied in multiple healthcare settings, and primary care should be the first stop. The reason is because we need to do a good job of prevention and education. So we have to have a model where we can spend the time, 30 minutes, 60 minutes, to understand someone's story. That's the first step. Once you understand, then you have to create goals. Big goals and then short-term goals. Ultimately, moving the person towards the bigger goals where it's going to be life-saving, it's going to be adding quality years to their life. That is the importance of the direct model.
At Live Active Primary Care, our patients get unlimited visits, they have no copays, and they can virtually access them anytime, even with texts and emails.
The thing I'm most passionate about with the direct primary care model is the preventative care, the focus coming back to how do we prevent the chronic diseases from being established in the first place. For me as a provider, it's important that we educate our patients. And in this model, we have the time to do it.
It's trying to not only educate, talk about diet, exercise, sure, that's great, but you gotta help people become accountable. How do you do that? You email them, you send them a little text. I always tell my patients I can be as annoying as you want me to be because the model allows me to do that. Delaying care is a huge problem. The cost is a huge barrier. So transparency is very important to us, and that's the heart of direct care. And so we're a membership-based model, and so for that flat rate, anything in the office that we do is free or at very little cost. We have wholesale medications. We seek cash pricing for imaging and laboratory. We are upfront, we tell you what the cash price is, which is very unlike any experience that we have outside the direct care model. For employers, it's a huge asset for them because it increases employee engagement. Why not have a direct practice that actually engages with your employees and motivates, coaches them, and works on their chronic conditions? We're going to reduce claims. We're going to reduce absenteeism and improve people's quality of life.
This is a different way of practicing, and for me as a provider, I can't see myself going back to the traditional model after having experienced this.
You need a quarterback. You need somebody who's looking at the whole picture and be available, be accessible. We're there when they need us, and that's how healthcare really should be.